Hello, friends. I'm Dr. Rosa Olyai, obstetrician and gynecologist. Today, I'll be talking about a very important issue which affects all ages and all females and men both. It's backache. Most often, we've seen that lower back pain starts between the age of 30 to 40 years. And the reason for this backache is generally when you put on weight, when you're obese, your abdominal girth is very higher than the normal, or it could be because of lack of exercise. You have a sedentary lifestyle where you sit all the time, or maybe it's an improper position. Position should be always when we are sitting down, we must have some support at the back. Sometimes, I see my patients who have delivered, when they try to breastfeed the baby, they try to put the head in the front, sort of pushing themselves front. As a result, the pressure comes at the back and you have backache. So you have to be avoiding putting your head usually in the front. We have, sort of pushing yourself and, coming in the front. Now, there are, like other postures that we do, which is very wrong, like when you try to bend and lift up things from the ground, you must make sure that you bend your knees when you bend down. Lifting a weight, all that has to be avoided. And of course, as you age, you need to have certain, exercises, certain kind of physiotherapies that you could do to make your muscles strong. Walking is one good way of making your knee muscles especially very strong. Sometimes, we have patients who've undergone a C-section and they relate the backache because of the spinal anesthesia, which is given behind. So there are certain, exercises which a patient can do post-delivery, post-cesarean section. There are, sometimes issues like lack of calcium and vitamin D3 in the body, which is not in your hand. It's just like because maybe you're not having enough of milk or calcium products. So you need to improve on that. So, what are the best ways that we can improve this backache? Because sometimes, it really is very irritating and it affects the psyche of the patients. However, let me also emphasize that sometimes mental stress, depression, this leads to issues like backache. So they have, issues coming from nerve problems that they develop. So we have to rule out the cause of the backache, which is there. What you can do is best, of course, as I said, decrease your weight. That's in your hands. So have a good lifestyle, drink enough of water, have green leafy vegetables, fruits, seasonal fruits, walk. That would be the best exercise. And of course, if you go to the gym, make sure you have someone who can help you out with the exercise. You have a very good, gym person who can, look after you. You just can't lift the weights on your own. Other thing would be certain blood tests that you could do if there's a lack of calcium or vitamin D3. We could give you supplements or medications can be taken, and that should be taking care of your blood levels. Other things would be, of course, decrease your stress level because, as I said, often, it is related with stress. So look at the work you're doing, see how it's affecting your mental health. Painkillers, yes, it's very good. You can be given painkillers, and that could be taken for over a time, because you see what happens when you have too much of backache. At that moment, you can't do any exercise. All you could do is rest. However, medications, anti-inflammatory tablets, medications could be taken and to decrease the level of pain. And then after that, once your pain is gone, you can start with your medications, exercises, or whatever. But you need to visit a doctor. In women, especially pelvic inflammatory disease, PID could be one reason. So you need to, work it out, tailor it out with the patient that what medication best, would suit you. My previous videos for female patients, especially lower backache, abdominal pain, these are interrelated issues. You can refer to those videos which have been shared earlier with you. So wish you all the best. Have a healthy, happy life. Thank you.